second marvelous speaker, third really, is Penny Cowan. Penny is the founder and executive director of the American Chronic Pain Association for the past 33 years. She's a strong patient advocate for those living with chronic pain. And her talk is Understanding the Patient with Chronic Pain from the Patient Perspective.
Okay, so my name is Penny Cowan. I'm the founder and executive director of the American Chronic Pain Association. I have no financial relationships to disclose. The mission of the American Chronic Pain Association is to help a person begin to, and their family, to know that there's a way to live with pain, and also to raise public awareness. But I think really the key, there we go, all right. The key of what we do is to believe your pain and to help you learn how to live with the pain. It's to give you hope and to validate. And I think that's really important. I think people with pain are very hopeless because they've been told, there's nothing we can do, you're just going to have to learn to live with it. And also just believing the fact that you have pain, because so many people are trying to think, to help people understand how their pain feels, and that's something that's really difficult. This is, all right, I keep hitting the wrong button. Okay, did it again.
Don't hit the middle button.
Don't hit the middle button.
It turns it black.
It does. Uh-oh, I broke it. Okay, all right, so what is chronic pain? It's the #1 cause of disability in the country today. According to the Institute of Medicine report, there's 100 million people who are living with some form of pain. Hit the middle button. All right, and as Dr. Lozier said, it's over $600 billion a year in healthcare costs, rehabilitation, and workers' comp. A huge cost. What is chronic pain? Chronic pain is what turns a person into a patient. What the American Chronic Pain Association is trying to do is to change that and help that patient become a person again. Pain is confusing though, if you think about it, right? And what we do is expect healthcare providers to make us better. That expectation that they know how to do everything and to fix us. Instead, we get stuck in this maze and we go from one dead end to the other. Our experience is that they should be able to fix it. They can give us new hearts, new lungs, new livers. It does not make sense why they cannot fix our pain. But think about it. What does pain look like? What does a backache look like? What's a headache look like? There is no way to determine or understand how somebody's pain is going to feel for them. It's impossible. It is invisible. So it's really hard to validate that pain when it comes to anyone else other than it's inside your body. You take it out, hold it in our hand and say, look, here's how much I have. We can't do that. But the biggest controlling factor around your pain isn't the pain itself, it's the fear of the pain. Because pain is never consistent. It's never 100% all the time. We do have good days and we do have bad days. And that's a big problem because on those good days, you know what we do. And we'll talk about that in a few minutes. And so because we learned, if it hurts, don't do it anymore. I think Dr. Lozier touched on that. And it's that fear of never knowing when it's going to hit, how bad it's going to be, and if we do something that made us hurt before, it'll hurt again. The fear is the controlling factor. We look to our healthcare providers, and unless they've been trained in pain management, they have no clue. They really don't know how to help you. They've been, in all of the training that they get, they may get 2 hours of pain management. Veterinarians get 80. A little different, right? I know. So what do they say? They say, learn to live with it. And what's it do? It makes us just want to scream. Right? I mean, I was told that over and over again, just learn to live with it. The problem is, no one told me how. This is what it looks like when someone tells you to learn to live with pain. I have no clue what that is. I don't know, it may even be solved. And if I had to stay here and solve it, I would be here forever. I have no idea. However, if I took a few classes, maybe in physics, started out in algebra, went on to geometry, maybe some, differential equations, or worked my way and worked really, really hard, had good instructors, I could solve that problem. I could solve it, but someone had to teach me. So you can't say, don't tell me to learn to live with it, teach me how. And that's what happened to me when I went to a pain management program 36 years ago. I went from patient to person. Going into the pain program, I couldn't even hold a cup of coffee. We'll talk about that later. But you don't tell them how to learn to live with it. You have to teach them how to do it. The goal of pain management, and again, and we're going to get this reinforcement of everything that we're all saying in different ways, because Dr. Lozier has said a lot of what I'm going to say, but I'm going to say it in a different way. The goal of pain management is to improve the quality of your life, increase your function, and reduce your sense of suffering. Nowhere in that goal does it say to get rid of your pain. Because no matter if you've seen the best of the best, there may always be some level of pain. But the key is that it doesn't, you can still learn to live a full life in spite of the pain. People have to teach you how to do it. And most importantly, you cannot be a passive patient. You can't sit there and wait for them to make you better. You have to become an active participant in your health care. There's only so much that medicine can do to help you. After that, it's up to us. We have to become active participants in our health care. That is key to all of this. So what does the American Chronic Pain Association provide? It provides tools that are easy to understand, informative, and efficient. And so one of the things I always hated was when they'd ask me on a scale of 0 to 10, what's your pain? Now, what's a 5? What's a 10? It took away my life, my ability to function. I wanted to say 20. And of course, they would have thought, okay, there's this nutcase out here. However, those numbers are meaningless. So let's look at it in a different way. So we developed the quality of life scale. It's going to measure function, which is the important thing around pain management, right? And we flip the scale. 0 means you cannot get out of bed in the morning. It doesn't get any worse than that, all the way up to 10. So you can get up and have a normal everyday activity. So if you're at a 2, that means you can get out of bed, you don't get dressed, you don't leave the house. Now it's clear, because now we're measuring function, which is key. Preparing for your visit, you have to be active. So this form and all of these tools that I'm showing you are on our webpage. They're all free. You can print them out, download them, whatever you want. I know there's some resource discs out there. You can pick them up. They're all on that as well. This one is going to ask you why you're coming to your next visit, then new symptoms since the last time, things that have improved, and then write down your questions, which is really important. And on the other side, it's going to ask you about all the prescription medications, your over-the-counter, your herbal supplements, and your vitamins. And you just click it, so made it better all the way to worse. And then the next little section is things you've tried. Eat ice, if it made it better, have it made it worse. And then things that may have improved. And things you've tried, is it improved or not, whether it's heat, ice, whatever, massage. This is also a daily activity checklist. And again, we talked about the amount of time that you have with your provider. So all of these tools are meant to get as much information out to your provider as possible. This one just asks you about some basic everyday things that most people take for granted unless they have pain. Sitting for more than an hour, maybe driving a car, working in a computer, even visiting with friends. All you have to do is check whether you're unable or easy to do. This one is what we call our Fibro Log, and this is an interactive tool. And again, you're going to measure pain, but it's so much more than just your pain. So what this one does, it's going to ask you where the pain is, the intensity, your quality of life, your activity, your sleep, your range of motion in the morning, your fatigue during the day, how the weather impacts your pain, your stress, your mood, how isolated you become, are you losing or gaining weight, your appetite, your snacking, and again, Dr. Lozier had touched on that about sitting around and just eating all day. Alcohol consumption, your ability to concentrate, to hear the pain, and your exercise. So all you have to do is circle these. Imagine how much information is going to be provided to your healthcare provider as soon as you get in. This is now interactive on our webpage. You can do register, you can create a login and password. There's a help screen. And all you have to do is go in and click on the numbers every day, 1, 2, 3, and then click OK. And then you can print it out. And now you're going to be able to capture a picture over a long period of time, activities, things that you do, and the impact it's going to have on your pain. Very useful tool for both you and your provider. This is what we call our Fibro Person. This is one of the many tools that we have, and hopefully this little video will work. And think, okay, there we go. So what it does is you go up there, click on pain management tools, go down, our webpage is a little different, communication tools, and go all the way to the bottom there, and you'll click on the Fibro Person. And then what you're going to do is click on male or female, and when you get in there, then put your cursor right where your pain is, drop-down box. It's going to describe exactly how the pain feels, whether it's deep aching, radiating, shooting, the intensity. Close the box up, the icons stay up there. And then the back view, you do the same thing, and you just click on all of those places where your pain hurts. Little icons stay up there, intensity, and then you print it, and then you come out with a picture of your pain. So now, instead of trying to explain all of that, now you have a picture of your pain. There are those for headaches as well. Same thing, except we also ask about other associated symptoms and then what makes the pain worse. And here's the picture of the pain map. And there's also one for back pain. Again, these are all on our webpage. You can look at those. This is the pain log, very similar. It's for any kind of pain at all. I'm going through these quickly so we have time to talk about some of the pain management coping skills. And then this is a follow-up sheet. And all this does is to remind you of the things your provider asks you to do. Whether it's whatever test you have, whether it's x-rays and lab tests, maybe, stress test, or the treatments, whether it's medication, weight management, when your next appointment is, restrictions that you have, dietary restrictions, and then recommendations. And all they have to do is circle those so it's easy for you to remember. This was actually our first graphical tool, and this is on how to take your medication. Many people forget. This one is take it day or night, or they can put it in the hands of the face on whatever time of day you take it. You take it with food or on an empty stomach, things you should avoid, what it may cause, possible side effects, and then how to store it and dispose of it. And this one we always put and never share any medication. And it's really important to use one pharmacy to get all of your prescription drugs. Talk to your pharmacist if you buy any over-the-counter herbal supplements, because those are all going to interact with prescription drugs. So it's really good to use that one pharmacy and begin to have a relationship with them as well. Okay, we have one on opioid-induced constipation. We talked a little about opioids, and a lot of people are really uncomfortable talking about this and bringing it up to their providers. So sometimes this side effects is worse than the pain itself. So we now created a graphical tool, and there's also a video. So on this one, it's asking you how many opioids you take as prescribed, and then as needed, and then your bloating, your abdominal pain, how many bowel movements you have during the week, glasses of water you drink during the day, medication, laxatives you use weekly, your exercise, your appetite, the fiber you eat every day, the alcohol you consume, and your stress. So now you don't even have to talk about it. You can just print this out, circle these little things, and off you go. And then the conversation has begun. And it's really a difficult thing to do. The video is really good. Don't have time to show you. So, 10 steps from patient to person. This is something that we do with the American Chronic Pain Association. These are just the basic coping concepts. These are some of the things that people can do as they begin that journey from patient to person. And it's not like any other, a 12-step program where you have to do step 1, step 2, step 3 at the same time. But saying that, step 1 and 2, really you need to do those, because without doing those, nothing else is going to help. Step 1 is accepting the pain. And that's the hardest thing for people to do. Because everyone thinks that, if I just accept the pain, that means I'm just going to sit there, quit, I give up. And that's not at all what it means. It means for today you understand that there's pain in your life. We don't know what tomorrow is going to bring. We have no clue. But that doesn't mean that we should stop our lives and keep trying and trying more things. Accept, okay, have pain, and move forward. And the next one is to get involved. To take an active role. If you sit there and wait for someone to make you better, it's not going to happen unless you become an active participant in your health care. So, learning to set your priorities. Why is that important? Just to think about all the things that have occurred since your pain started, and the many things that you have sort of put off over the years. And it sort of builds up on you. It's like a mountain over here. Just everything, and it keeps going, and it just eats away at you. And pretty soon, on one of those good days, you think, okay, I can do something. But there's so many things you don't know where to start. So what you might want to do is on your way home to make it little 3x5 index cards. And think about all the things that you want to do, you should do, you have to do. And just write one on each of those cards and put them away. It may take you a week, may take you a month to do it all. When you have all those identified, take those cards and just lay them all out on the big table. And realize how many things you have left go since your pain. And they're not all sitting over here in this mound. They're right in here causing you stress and tension. And guess what? Stress and tension is going to create more pain. And then just step back and look at all those cards and ask yourself, of all the things there, what's the most important thing to you at that moment? And you pick that up, and now you have your priority, your first priority. You have a starting point. You have somewhere to begin. And the rest of them you can sort of put away, depend on, what, on different piles, things you might want to do, things that you have to do and that you should do, and put them in different piles. And you can continue to add to that pile, but now at least it's organized. Because one thing pain does is makes us feel very disorganized. And then most importantly, you have to set goals for yourself. And this is where the not listening to your body and doing the most you can do on those good days, and we all do it. I did it all the time. And every time I did it, I learned that whatever I did that day is going to create pain, so don't do it anymore. And after 6 years of don't do it anymore, I became so deconditioned, no matter what I did hurt. And the fear was just so increased in me. And we don't listen to our bodies. On those good days, when we want to start doing something, maybe because we can actually do it, you can feel that first little ouch, and your body goes ouch, what do? You ignore it, right? Well, you can handle a lot more pain than that. And then there's that second little ouch, and you ignore that. And we go on until it screams. And the next day you wake up, and guess what? You can't move. You convince yourself, okay, no more, can't do that anymore. Listen to your body. Take a 5-minute break. Take a 10-minute break. Maybe for a little bit of time, do something you wanted to do, and then relax the rest of the day. Read a book. And guess what? You may have a better day the next day. It's all about pacing and listening to your body. Very key, very important. Your basic rights, and these are so key, because what happens when pain takes over our lives? We lose our self-esteem. It is depressing to be in pain. And we lose our identity. Everything that we wanted and could have done, we lose. So these basic rights are going to empower you. You have the right to be treated with dignity and respect, regardless of whether or not you have pain. You have the right to say no and not feel guilty. You have the right not to justify your behavior. This is an important one, because what happens over a long period of time is because of the fear of the pain and all of the experience, when someone asks us to do something, we never know quite how we're going to feel next day, next week, next hour. And so what do? Well, I'm not feeling well. So we tend to begin to talk about our pain more and more and more until it becomes our universal excuse. We don't mean to do it, it just happens. But you know what? You can say no, and you don't have to justify your behavior. So maybe your mother-in-law, your husband or your wife asks you to go to your mother-in-law's for dinner that night. You can just say no. You don't have to say, my back is killing me and her chairs are bad and I can't sit, when in fact you really hate her and you can't stand her cooking. But you don't have to say that. You can just say no. Not tonight. I don't feel like it. That's it. You don't have to justify your behavior. You have the right to do less than humanly possible. You don't have to kill yourself. Everybody has that right. You have the right to make mistakes. You have the right to ask for help or assistance. Here's all the rights. They're very important. They're on our webpage. We could talk a lot more about all of these things. Just look at them. This one, recognize your emotions. And this is really important because so many people, you keep hearing, pain's all in your head. Well, it is, you experience it in your head. I think Dr. Lojo, it's not something that, that anyone else can understand. We experience it both physically and emotionally. You can't separate our mind and our body. And what we feel physically, we're going to feel emotionally. When I went to the pain program, the first thing they did to me, and I actually went there to fail, because I did not believe after 6 years that anyone was ever going to be able to help me. And I only went there to prove to my husband there was no hope. And so it took me a very long time to get through the pain program, and after 36 years, I still hold the record for being there the longest. Not good. But, and people say, well, if you went there to fail, how did it work? And one thing, it took me a while to think about this, but I finally realized there was this tiniest little speck of hope still left inside of me. There were actually 3 of them. It was my husband and my 2 children. And they were so far buried and got so lost in me, it took me a while to find them. And what's really interesting is everyone sitting here tonight, you'll have at least that tiniest speck of hope still, or you wouldn't be sitting here now listening to me. I just want you to know that you're also very hopeful. The first time I got there, they gave me a book. It's called The Angry Book, and they said, you got to read it. And I'm thinking, what does this have to do with pain? Why? I'm not angry. I'm here because I'm in pain. But they said, you have to read it. So I read it. And as I read each chapter, I defined a different kind of anger. The book is still available today. It's called The Angry Book by Dr. Theodore Rubin. It is still available. By the time I got done reading the book, I was the angriest person in the world. And I thought, this isn't good. This is not helping me. Now I got pain and I'm an angry person, and it was just not a good thing. But what I took away from the book was the slush fund that he talked about at the end of the book. And what that is every time we have a negative emotion, we put it away. So I look at it as this bucket that we carry around with us, and it's a drop of water. So every time we ignore one of our negative feelings, we put another drop of water in our bucket. Another drop, another drop. And guess what happens? Pretty soon the bucket gets really full. And there's that one last drop of water, right? And that one last drop, somebody comes and says just the wrong thing to you, and you just dump the whole thing right on them. And they have no clue, what is this all about? All I said is, and here they are. The problem is, it's not really this little bucket we're carrying around, which could be very heavy. Again, it's all in here. Every time we ignore an emotion, a negative emotion, we bury it deep inside of us. And it only creates more stress and tension. And guess what? It's going to create more pain. Don't ignore your feelings. There are no wrong feelings. You can't control them. I wish we could, but we can't. It's the actions that you take on the feelings. That's what you can control. Pain's going to create a lot of emotions. The reason I use this picture is because we think, the pain is all about us, right? But it's not. It has an impact on our families. This is a husband and wife. One of them has pain. It's the guy. He's sort of sitting there repressing that pain. You can see him just trying to bury it deep down inside. I'm really good at that myself. He's trying to save her feelings, but look, she's not real happy. It impacts the families in almost the same exact way. We did a survey for 3 years on family members, interviews with them, to see if there was any difference and what were their needs. What we found out is there's only one difference between a family member and a person with pain. The family does not feel the physical pain. That's it. So I'm going to show you, hopefully the video is going to work. We just created it's called Family Matters. It's a whole new video series. This is a small piece of it. These are family members. Take a minute for it to start.
We had plans. We had a good life. And it's gone. He's changed. He's not the man.
Loss. What's going to happen to him? What if it gets worse?
Fear.
Why isn't there a cure? That doctor hasn't a clue. How could this have happened to us?
Anger.
There's no end to this. I don't see a way out. It's like a bad dream.
Depression.
It feels as if our world is falling apart.
In our last video, we talked about letting go of blame and guilt and accepting that a member of your family has chronic pain. Letting go is impossible without recognizing the strong emotions families feel when they are confronted with the reality of chronic pain. Even though only one person feels the physical pain, the whole family feels the effects.
So there you go, in their own words. Relaxing. You experienced a little bit of that just recently, with the break that we had. It is really a key component. Listen to your body, and you can actually tell it how it is you want it to feel. But it's a learned skill. It's something you have to continue doing over and over again. There's a lot of relaxation videos and tapes available. If we could just all go lay on this nice warm sandy beach and listen to the waves crashing against the shore, the sun beating down on us, then we might be able to relax. But that's not possible. I want you all to do something for me right now. In your minds, I want you to count from 1 to 25 And at exactly the same time, say your alphabet. Can't do it, can you? You know why? Because you have a one-track mind. A one-track mind, keep that in mind. So while you're thinking about laying on this nice, warm, sandy beach, listening to the seagulls overhead, the waves crashing against the shore, while you're doing that, for that instant, you're not thinking about, my God, my back is killing me. So for that instant, you've reduced your sense of suffering. One of the goals of pain management. It is a learned skill. So people say, I can't do it. We can all do it. You just experienced it. You know, breath is a wonderful way to do it. There's a lot of relaxation exercises out there to help teach you how to do it, but it takes practice. It is a learned skill. But you also have to listen to your body. So when you feel that first little ouch, that's when you immediately do it. For me, it's been so long that it's an automatic response now. It's been something that I really had to practice, though, for a very long time. And then there's exercise. And it's not that passive physical therapy, it's an actual exercise program that you have to really get into. Talk to your healthcare provider, see what you're physically capable of doing. We actually have a workbook with all these coping skills in there, and we have 18 stretching exercises illustrated, but we cannot make physical evaluations. Take them to your provider and ask what you can do. And when you do, start that out very slowly. Don't set yourself up for failure. Remember, pacing, starting out one step at a time. But exercise is really important. For every day we spend in bed, it takes us 2 weeks to get back to where we were physically. Imagine how deconditioned you've become. No wonder it hurts when you do something. So do it very slowly and gradually and build yourself up. Talk to your healthcare provider. Find a way for you to begin to start a realistic exercise program for you. Total picture. And so many people with pain, all they want to do is tell you about what they can't do anymore. Well, my question is, what can you still do? I want to know what your abilities are. And that's where you need to focus. Pain takes away things, but you know what? As you age, your life changes anyway. So let's begin to focus on what we can still do. Explore things that maybe you never thought about before. Recreate yourself. Many people have done that. Think about possibilities. That's what's key. Attitude is key to everything. And then there's outreach. And that's really where I started, because 35 years ago when I left the pain program, I had realized I was not the only person in the world, that there were other people who were also living with pain. And that what they taught me there was too good to keep for myself. Do you want me to move away from there? Maybe that'll help. Yeah, I'm making it sing. Okay. Did you turn this one off? Can you still? Okay. Just the echo. And so what I had learned was too good to keep to myself, but most importantly, it was my own fear. It was my fear of not wanting to go back and be a patient again. And I knew that I needed to continue to do everything they taught me while I was in the pain program. And what better way to do it than to share with others and get that positive reinforcement every day. So there are peer-led support groups all over the country. We'll help you do it if there's not one in your area. Now, to put this all together, it's really important. There's a little story about a car, and I think that you all got cars. I think because I sent them up. Did you all get your little car in your bag? Okay, there's a reason you have that car. So now I used to tell you this story, but now I'm going to show you the story. Here it is. It's hard to know how to move forward once chronic pain enters your life. It helps to think of a person with chronic pain like a car with 4 flat tires. Our expectation is all we need is one medication or treatment that will take away the pain. But it only puts air in one of our tires. We still have 3 flat tires and cannot move forward. Perhaps the medication or treatment has provided 25 or 30% relief. Let's leave that there and ask ourselves what else we need to fill our other 3 tires so that we can resume our life's journey. For each person, the necessary combination of therapies and interventions will be different based on individual need. Unlike traditional medicine, where the patient is passive, living a full life with pain requires that we become active participants. We need to work with our healthcare providers to find out what we need to fill up our other 3 tires. Biofeedback, physical therapy, counseling, pacing, nutritional guidance, a support group, and a host of medical treatments are a few ways to fill up our tires. Once we have all 4 tires filled, it's our responsibility to maintain our car. We wouldn't take it back to the dealer and ask them to fill it up with gas or wash our windshield. That's our responsibility. If something goes wrong with the car, we take it in for a checkup. It's the same with our wellness. You see, pain management is much more than one simple treatment. It takes a team effort, with the person with pain taking an active role to live a full life in spite of chronic pain. And that's what we hear so often from people that have tried everything and nothing works. And I said the same thing, but they kept emptying and filling my one tire. They never said, okay, maybe this is going to be something helpful. Let's ask ourselves what else we need. That's the key. But you have to be the driver of that car. You have to be a significant part of the treatment team. Here is our website. Here is our phone number. Feel free to call us. Visit our website. I gave you the 50,000-foot version of a talk that I give that's much, much longer. Hopefully, you got something out of it, and I don't know if we take questions out, not now.
Can I say to the little red card in your bag, it has that information on the website?
Yes,
the phone
it does.
number, so you have it in your bag in your little card.
So thank you very much.